everyone, it's Lisa. I'm doing my 6-week post-op video for upper jaw surgery. First I'm trying to make the videos shorter because my videos are so long because I have so much to say. But I'm gonna try to make this quick and short and to the point. I'm gonna do an overview for you that don't know what I've been through really quickly. This is a picture of me 9 years ago. This is how I started. I guess you can see that. That's how I looked with no treatment at all. At that time in my life, I came together, I ate, I exercised, but I had a lot of pain. I had a lot of jaw pain, and I had lockjaw a few times in my life. And then at that day that picture was taken, I couldn't move my neck to the right. It had locked. And that was my appointment with the TMJ specialist, my very first one. And that's when I found out that I had occlusal disease, severe. I didn't even know what that was or what that meant because my whole life I've been able to eat up to that point fine. I didn't connect the two. So that started my journey. I was put into an upper splint. That's a picture of it because I don't have it anymore. And I wore that for about 3 months. And then I don't have a picture of me hitting my 2 front teeth because then my lower jaw moved and I didn't have any posterior contact at all. I just hit my 2 front teeth, and that was about, I don't know, 8-9 years ago. And I was referred to an oral surgeon in Miami. Then I was also referred to an orthodontist to see where my centriculation really was. Anytime either one of those specialists would manipulate my jaw, I would hit back left only, and I would have an open bite, but then they would let go and my muscles would take over, and I would again hit my 2 front teeth after wearing the splint for 3 months. Only 3 months. Then I moved and they told me to go ahead and start orthodontic treatment. So I went through I wasn't wearing the splint anymore, and I figured that braces would fix my problem. So I had 2.5 years of braces. During that time I was pregnant. I was 34. And I thought that everything was going to be fine. During the end of my braces treatment, I was in really bad jaw pain again. I didn't have any locking going on. But I was in a lot of jaw pain. So my orthodontist, this is how I ended up. Here's a picture of me. It looks pretty good, huh? The side looks pretty good. Everything came together. I don't know if you can see that. Everything looks pretty good. Only one problem. Jaw pain. Really bad, especially in this joint. So the orthodontist at that time said, you know what, you may need to go back into a splint. And I was like, what? I did a splint for 3 or 4 months. So, but I was in so much pain that I went to another TMJ specialist in the new area I lived, who was supposedly a really, really good one. And he was really, really upset with the orthodontist because when he manipulated my jaw, I had back left tooth only 1 tooth contact. So he put me into an upper splint, and I have that, but that's kind of changed here and there. So I went back into a splint. Yay. So I was in the splint, and you have to have many adjustments when you're in a splint. You have to be with a good TMJ specialist because you have to be hitting evenly in the splint, and then your jaw moves and things relax and muscles relax, and then you don't hit on the splint anymore, and then you're in pain, and you go back to the TMJ specialist and they adjust it again, and it's constant, and it's very, very draining, very, very difficult. I stuck with it, and I did that for 3 years, people. I was in, 2.5, because I guess it's been 3 years now. I was in a splint for that long because he told me, the TMJ specialist said that my jaw joints need to heal. I was put on a lot of supplements. I did a lot of tests to see if I was deficient in things, and I was put on supplements to help my jaw joints heal because at that point they were arthritic. And he said that we just got to keep going until my lower jaw, my mandible stopped moving. Took a long time, My muscles were very much in a bad place because they were trying to match everything up with my upper jaw. So finally, towards when I started to have no pain and my jaw started to not move very much, I couldn't eat because my bite had opened up and I was hitting the back two teeth. And they wanted me to hit the back left only on my own, which was in centriculation. So I ended up doing that. He said, at that time I figured they would just shave down my teeth and make everything come together because I was open, really open in the front. But the TMJ specialist said, no, you need jaw surgery. And that's how I am. That was last year, and that's why I did jaw surgery. Because my lower jaw and my upper jaw were nothing was matching up because I had a skeletal deformity. Nobody diagnosed me with. So that's it in a nutshell. That's the overview. It only took 6 minutes. So it was a long time. So I'm 6 week post-op. There's a close-up of upper jaw surgery where they shaved down the back of my jaw and moved it forward. And here's a close-up of my bite. I got rubber bands. So now I come together again. And here are my profiles. I don't really do my profiles very much because my skeletal deformity was internal, I guess. So I really, I didn't have like a really big, I didn't look like there was a problem. So I just recently went to my oral surgeon and everything looks so good that I don't have to go back for another month. And I got to go to the orthodontist, and that was 2 days ago. And so I was right at 6 weeks because Monday was 6 weeks. So the orthodontist took out the surgical wires, which was so awesome. Took out the surgical wires, took out some of the surgical hooks, and then put in new wires, and took out the thing I had in the back of my upper jaw, which I had these strange wires back here to get my upper back molars out of the way for the surgery, and now they're going to bring them back down. So that's gone, and I have new rubber bands, which are so much better than the surgical rubber bands or the ones the surgeon gives you, because the ones the surgeon gives you are so super tight. You do feel like you're wired shut. So I was very happy to have that done, even though new wires always hurt and cause, tooth pain, but I was happy to have the surgical wires out and get some color into my mouth, since you're just basically metal mouth before surgery because you have so much steel in your mouth. So I was really happy to have that appointment and get things going so that I can get the braces off too. So diet has not changed. I'm 6 weeks post-op and I am on a soft food diet. It's still very difficult to chew because I kind of don't know how to chew, because I've used my lower jaw so wrong my whole life, because I am 40. So it's been a long time. So I don't really know how to chew or where to chew. But it's also very difficult because I'm still very numb. I still can't really feel my upper teeth or my gum really. It's getting better. I'm still very tender in here and swollen because all of these muscles were cut. And so now they're super duper duper tight. And I do have to do some exercises like in the mirror. So diet's the same. Nothing's changed with that. And the pain, I do have a lot of muscle pain. Your muscles do get super tight after surgery, and they are supposed to let up or release as you heal. Now, since I've had so much experience with that, I know that for me, my body needs help with that. So I am in muscle pain, but it's not, I'm not taking Advil every day. I am taking Advil at night for the rubber bands because they hurt. But other than that, it's been okay. I am so tender in here that, of course, it hurts to smile a little bit and it hurts to laugh. these braces, since they're so close to my lip now, they rub on my lip. So I do usually normally wear some wax right there. So it's manageable, the pain. And then I do have ear stuffiness, which I've had before in my life because of the muscle tightness. And so I'm just hoping that that will go away with time and with some therapy. I do get like some burning sensation sometimes in here, but it goes away because I am still I'm still numb a little bit under my eyes as well. Right under here, you're just not fully there. So at this point, I'm not in a splint, as you can see. They told me that if I do start to have severe jaw pain, then I would need to go see the TMJ specialist again and possibly go back into a splint because I could be clenching or grinding at night too much. So that's just kind of like, let's wait and see. Sleeping is still getting there. It's getting better, but it's still hard to sleep because I was so used to having something in my mouth, and now I don't have a splint. I was so used to having a splint in my mouth, and I don't have one in my mouth anymore. So it's all been an adjustment. I really do miss food because it's been a long time for me. It's been over 3 years since I've had a normal diet or a salad or anything like that. So I just take it day by day. Some days are good and some days are bad because of the emotional, because of how difficult it is emotionally to go through something like this. But I can say it's getting better day by day, and I just take it day by day. I do plan on going back to work next week. So we'll see how that goes, but that's it for now. If you have any questions, let me know. And the next time I do an update, let's see, I'm at 6 weeks. I'll probably wait another couple weeks and just kind of give you a quick update of pain and TMJ and food, because that's a big one. I know people really want to know when you can eat and when you can chew and stuff like that. So, and I'll let you know about my classes, because I think that once I can start chewing, they want me to take some myofunctional classes to help me to learn how to chew with this new bite that I have again for the third time. I've had my teeth come together. So hopefully this is it for me, but I do go to the craniosacral therapist on Tuesday to have a session with him to try to free up the muscles a little bit and get them to relax some more. And not just in my jaw, but in my neck and my back and pretty much your whole body, so that it can adjust to this new jaw position that I have, because my lower jaw was so far down with the open bite that now it closes. So literally it used to be like here, and so now it's up here, so that my joint auto rotated like this. So you can only imagine what that's going to do to the rest of your body. So I'm pretty much an advocate for whole body treatments when you do have anything going on, or any change going on in your body, or any surgery or any pain. I feel like you need to treat the body as a whole. So I do that on Tuesday morning. That is not covered by insurance. I pay that out of pocket, which is really difficult financially, but it's very important for me personally to have my whole body worked on. So I will give an update on how that treatment goes. I've done many of those in my life, so I'll let you know how that goes, if how much it helped. And oh, I wanted to show you how wide I can open my jaw too. I take these rubber bands out. Okay, so I am at here. That's how wide I can open my mouth. And that's not very wide. I mean, it's normal for where I'm at for 6 weeks. It's actually a little bit better than they say a lot of people are. But you have to open up your mouth pretty wide to eat. And I jam the spoon and fork sometimes because I think I'm open wide enough to stick mashed potatoes in my mouth, and I'm not. So I'm really hoping that that gets better, and in time because I just want to be able to eat a hamburger like everybody else. So that's it for now. And if I think of anything I missed, I'll do another video, but I guess I'll talk to you guys the next time. Bye.